Hi class, this is another video to accompany week 13 point of care testing lab, and this video specifically teaches you how to counsel on providing a patient with results for either an HIV or an HCV test. This video is important because it is going to be useful for you to complete your activity, which is located under the activity section, week 13. It's on the same assignment as your sexual history assignment, so make sure you're reading through it. And as you read through it, you'll see that one of your tasks is to counsel on a non-reactive or reactive HIV or HCV test. You only have to pick one test, and the test either is going to have results that are non-reactive or reactive. So for instance, you might decide, okay, I'm going to counsel a patient on a non-reactive HIV test, and you would counsel on just that portion. So you just got to pick one. I wanted to provide you with a video and with steps just to make it a little bit easier so that you fully understand how I'm going to be assessing you on this portion. It's also important because I will also be asking you test questions on this as well, so you want to make sure you review it in its entirety. So here are the steps that I want you to complete for that portion of your assignment. You want to introduce yourself and your position, verify the type of point of care test the person has received, so is it HIV or HCV? Instruct the patient that you have completed the test and that you've waited 20 minutes for the results. Inform the patient of the results using terms non-reactive and reactive. Remember, we're not trying to use the terms positive or negative for this course. Provide additional information as necessary. This was pulled from the slide set. So I have two slides, one for HIV and one for HCV, that goes over what additional information you should know about when a test comes back as reactive, non-reactive, or invalid. So if non-reactive for HIV, you want to consider, has it been at least 3 months since the last risk encounter? If non-reactive for HCV, has it been at least 6 months since the last risk encounter? If non-reactive for either and the patient engages in risk activities, they would want to test regularly. And if reactive for HCV, has the patient had HCV in the past? So again, just some things to consider. You also want to consider when the patient should be following up with their provider. So if a patient is non-reactive and has not been the appropriate amount of time, then they would want to check with their provider and potentially get another test done. And if the patient is reactive for any reason, you want to refer them to their provider. So I'm going to give you two demonstrations, one on a reactive test and one for a non-reactive test, again, so that you know exactly what I'm expecting from you for your assignment. So here's your first demonstration. Is going to be for a reactive HCV test. Hi, my name is Raven and I'm your pharmacist. I just want to verify, are you here for the results of your HIV test or your HCV test? Okay, so you are here for the results of your HCV test. I just wanted to confirm that. Well, the test has been completed. We've waited 20 minutes to read your results, and your results have come back as reactive for your HCV test. I did want to ask, have you ever had HCV in the past, or has your doctor told you you've had HCV? Okay, so you have had HCV in the past. Sometimes if patients have had HCV, their tests might still come back up as showing as reactive. That is common. For that reason, we recommend that you go to your provider, your doctor, and they might want to do another type of test, or they might want to draw labs. So I do appreciate you coming in and getting your test results, and I hope you have a nice day. So that's pretty much what I'm looking for that type of test. I'll also give you a demonstration for a non-reactive test. Hi, my name is Raven. I'm your pharmacist. Can I verify which type of test are you here to receive the results from today? Is it an HIV test or an HCV test? Okay, so you are here to receive the results from your HIV test. I just wanted to confirm that. Thank you. We have completed your test and we've waited 20 minutes to read your results, and your results have come back as non-reactive for the HIV test. I just do want to add a few points. You always want to consider the time since your last risk encounter. A risk encounter is anything that might put you at more risk for HIV. And if it has been at least 3 months since that last encounter, then you're likely okay. If it's been shorter than that, so if something occurred within the last few days or few weeks and you're coming in to get a test, then it might be too soon for the test to tell if you have anything in your body that might show up as reactive on this HIV test. So if you happen to engage in activities that might put you at an increased risk, you would want to test regularly just to be sure. And it's always good for you to follow up with your healthcare provider, especially if you're not sure when the last time an encounter may have put you at risk. So I just wanted to provide you with that information. And again, thank you for coming in to get your results. So that's the basis of what I'm looking for, guys. Doesn't have to be too drawn out. I just want to make sure you hit on some of these key points. If you have any questions, please let me know. Contact me via email, or you can log in on Monday or Thursday for the Zoom open, well, like office hours, I guess, that I'll have. And I can go over tests with you. I can go over counseling steps. Whatever questions you might have, I will be there to answer them. And I hope you guys have a good evening. Thank you.